have a seat in the booth.
As an audiologist, Rachel Gibson is among those competing with hearing aid giant Amplifon, a partner of health insurer Bupa. She represents independent audiologists concerned about the advice patients are getting through the deal.
Bupa has told them that they need to go to Amplifon to be able to receive their private health rebate.
It's not true. Patients can get a rebate elsewhere, albeit smaller. One patient even reported Bupa told them they must take their child to Amplifon for a hearing test.
However, Amplifon doesn't provide paediatric services and didn't provide the auditory processing assessment.
Audiology is among the offerings private health insurers have been slowly moving into for decades. It's called vertical integration, but critics say since the pandemic it's increased exponentially through telehealth and home hospital offerings, and it's a problem.
We're now at a point where our major insurers are some of the biggest players when it comes to delivering healthcare.
In December 2025, Medibank Private was given the green light to buy 61 GP clinics by the competition watchdog. Through its Amplar Health subsidiary, it owns stakes in 7 hospitals and a majority share in more than 100 other GP clinics. Bupa has plans to grow from 33 medical centres to 65, as well as increase the number of its mental health clinics to 60. NIB has its own telehealth weight and hair loss venture. HCF offers free GP consults to some members through GP2U. Doctors are concerned insurers' foray into GP care could create incentives to refer patients to preferred specialists or hospitals.
It's very easy for them to encourage referral to their own facilities. It means that patient choice is reduced, but it also diminishes the competition that's available in the marketplace.
The insurers maintain they don't tell doctors what to do. Catherine Bassett represents Catholic hospitals who are concerned Amplar's Hospital in the Home program competes with their version, but Medibank says it uses a mix of providers.
The challenge is when you have a funder that's also delivering care, they're looking at it from a cost containment perspective as opposed to a patient access, choice and quality perspective.
The Australian Medical Association want a new regulator to put guardrails on insurers, something the industry rejects.
What they're doing is investing in practices to ensure that they're meeting the needs of their consumers when it comes to prevention.
GP2U provides fast, convenient access to online...
The major insurers also offer free or discounted telehealth appointments to members. It's a legal loophole in telehealth laws, but for some it's considered queue jumping.
In a situation where there is a supply shortage of GPs, that does pose a particular risk of a two-tiered health system.
It certainly needs to be looked at in great detail by the government. At the moment it's just happening willy-nilly.
Health Minister Mark Butler said the government had no plans to allow insurers into general practice, even though they're already there, but supported complementary services within Medicare rules. Health insurers reject any suggestion that this is the beginning of US-style managed care. And while there are laws in Australia to prevent this, experts say it's happening in subtle ways.
So they're framing them as things like pilots or experiments or ways to test innovation.
The health funds are not trying to take over the whole health system. What they're trying to do is to plug gaps in the health system that consumers are experiencing.
Amplifon was contacted for comment. Bupa says its partnerships save patients money. Insurers say anyone can access their GP services and their moves are about preventative healthcare. Whether these moves help or hinder healthcare, it's up to regulators to decide.